Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose Naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. This show is sponsored by Dixon's Chemist, who are the experts in LDN and associated treatments in the UK. Dixon's Chemist are the most cost-effective for LDN in all forms within the UK and Europe, maintaining safety standards far in excess of what is required. Why would you choose to get your LDN from anywhere else? Call 0141 404 6545 today to speak to their LDN experts. Today my guest is Dr. Colin Taylor from Ohio. Thank you for joining me, Colin.
Thank you for having me.
Now, it's very interesting, your use of LDN and what you've been doing. But first of all, could you tell us what made you decide to become a pharmacist?
Of course. Back when I was in undergrad, I was a focused major on biochemistry and molecular bio. It was always a passion of mine to see how medicine and just chemicals in general worked. So it was only natural after a course of a few years that I started to have professors that mentioned pharmacy to me in the beginning and kind of helped me mold my interest in both human health and also the general science and chemistry of it into one to kind of point me in a direction of pharmacy. I was always very research-based, so the general retail side of pharmacy was one that interests me, but didn't really draw me in as much as it typically does. It was a few years before I started pharmacy at The Ohio State University, and there is where I first got introduced to the concept of compounding, where pharmacists are able to work with physicians and kind of develop very unique, very individualized patient medications and treatment options. It's one where we can take into account patients' issues with allergies and side effects to filler agents that you typically find in a lot of general pharmaceuticals and be able to kind of work in a different way with them and help them solve a lot of the cases that aren't very typical in the pharmacy world. So as that kind of took its first steps, I was introduced, luckily, at an early age to Mr. Tony Bukta. He is the owner and pharmacist of Central Ohio Compounding Pharmacy that I currently work at. Met him at an early age in pharmacy school and slowly started to build a relationship. I had a rotation with him in my last year of pharmacy school, and we kind of worked on a few projects together. And one thing led to another, and he asked me to join on after graduation to help him work with LDN. And I had started my research with low-dose Naltrexone a couple years before when he mentioned it during the rotation. So this was kind of our first big step to be able to come out and actually really delve into the research that was just coming out at the time. So we worked together, did a few side projects, and then decided to start our low-dose Naltrexone monitoring and management program at Central Ohio. Last July is when we launched. Central Ohio is really kind of focused on the idea that I first had when I got interested in pharmacy, which was really solving complex ideas and complex problems for patients. It was one that it was a location that was extremely friendly, extremely open, but really wanted to work side by side with the doctors and the patients, creating almost a trifecta of a relationship between the patient, the physician, and the pharmacist to give the patient the best possible outcomes with their medication. So that was almost just a natural fit when it came down to it. As we worked a little bit more on it, we started to realize that LDN was a focus that we could really kind of hone in on. Central Ohio has been around and compounding for 20 years now. We just celebrated our anniversary a few months ago, and we've been compounding low-dose naltrexone for many, many years, but this was the first time we really started to see a resurgence of it. So we knew that there was kind of an opening and a position that we could fill there to help educate patients and educate physicians as well on the use and the actual outcomes for the patients.
Wow. I'm so impressed. So could you tell us a little bit more about the LDN program?
Of course. So our general idea is to bring, again, the physician and the patient closer into the patient's own treatment. We want to make sure everyone's interactive and on the same page when it comes to it, since LDN, like many other compounds, are a focus that really needs to be unique to the patient. No dose is the same, no treatment is the same, and everyone kind of has their own different outcomes with it. So our general idea is to not only educate the patients on what the proper way to take it, what to look for side effects or interactions, but also to educate the physicians on proper ways to dose the medication and also help them relieve some of their workload with following these patients. There was a few doctors that were really passionate about wanting to get involved with low-dose naltrexone, but they didn't have the time or the resources to really invest into it. So our general idea for it was to be able to follow the patients and report back to the physicians and kind of give them an idea of how the LDN is affecting each individual patient. As typical with a lot of our patients, what happens is a lot of patients will come to us and ask, they've read somewhere online, LDN will be helpful for this and that, and what they kind of get it into their mind that they would like to try this option. A lot of these patients have had a really rough time with trying other medications and it just not working out for them. So we will always refer them to a doctor that is experienced in LDN treatment and really passionate about wanting to make sure they get the best treatment. After the doctor sees them and evaluates them, makes sure LDN is a proper medication that should be used for the patient, they'll send the prescription to us. We'll compound it following any unique needs they might have. If they're allergic to certain dyes or anything, we can exclude those or substitute certain things for them to make it, again, very individualized. But most of our doses are written as a titration or every couple of weeks a dose increase. And what we found when we first started the program and when we first started looking into it was that a lot of the patients fell off within those first few weeks to a month of taking LDN. They weren't given proper monitoring, they weren't being followed, and sometimes even side effects like the vivid dreams are always something that kind of pops up. The difficulty sleeping really made it hard for patients to stay on this medication. But our main focus with the program was to have a pharmacist, myself in this case, follow the patient for those first at least 3 months of taking the medication. That way I give them a call every time that they would have a dose increase as scheduled. Anytime that they would have a issue sleeping or difficulty with the medication, we would have an open line that they could call me or email me, voice their concerns, and then go about working out a new strategy to keep the LDN on their medication list so they could keep taking it and, again, out to a couple of months, actually start to see the major impacts of LDN without having to worry about losing them in kind of the general flow of what a typical pharmacy would be.
Mm-hmm. And with your program and the monitoring, and I must say, you must be very dedicated to follow all your patients like that. What has the fall-off rate been since you started your program?
Since we actually started, we've had several patients prior to the initiation of this program that we had with LDN, and I at the very start checked in with them, made sure everything was going fine and that they had no issues. These were patients 2 to 3 years out of taking it on LDN. So we basically did a quick check-in with them, made sure everything was going okay, that they were getting their doses on time. And after that, we moved on to all of the new patients that we did have coming in. We would walk them through the process that we spoke about earlier, and then work with them to try and do our best to make sure that any issues that they might be using it for were handled. So far, we've had a really good rate of comeback. So I believe we've only had a few patients out of the 30 to 40 we currently have that haven't reported back. And usually that's in relation to whatever their condition was. We had a few patients used in unique cases that the physician decided to take it off, or we decided as a group to take off the medication overall. So most of the dropout rates have been eliminated due to just a patient getting lost versus the group or the kind of triangle of physician, pharmacist, patient deciding as a group to remove the case overall.
Mm-hmm. So you find that it's a successful method for everybody to feel confident and comfortable if they hit a bump in the road, as it were.
Exactly. The biggest thing that we always experience with the LDN is definitely a sleep issue. And when you start to interrupt patients' sleep, they really get a little hesitant about continuing the medication. So we've kind of found that the program overall, following them and checking in with them, has really given the patient and the physician confidence to keep LDN going so that they can actually start to see the benefits.
Mm-hmm. So do you compound LDN in, liquid and capsules and sublingual and cream and whatever else the patient may require?
Essentially, we will compound in anything that the physician is willing to write for and comfortable with the patient taking, and also anything that would aid in easing the burden of just taking another pill or another capsule. Primarily, most of our patients currently are just focusing on capsules, but we do the compounding in a wide variety as need be.
Mm-hmm. And you were saying, if people were allergic to certain colours, these E numbers, that you'd eliminate those. And I suppose the same goes for fillers.
Exactly. The first thing we always do is we screen patients up front, especially if they're new to our compounding pharmacy. Many of our patients currently are older patients that have worked with our pharmacy before, have other compounds with us. So if it's a new patient, we like to screen them, make sure any allergies come up. We can make notes of it beforehand, and then we can bring that to the physician, let them know, and talk with them, make sure it's okay to remove certain aspects if they're gluten intolerant or if they have celiac disease. We can make accommodations for that as well. So essentially, we just want to make sure that nothing is overseen when the patient does transition from a physician's office to our pharmacy, so that they, again, don't have any additional hurdles they have to deal with taking the LDN.
Mm-hmm. And how do you do the screening? Is it a blood test?
So essentially, it's patient reported at this point. So if by the time they get to us, they have gone through several rounds of usually general pharmaceuticals. So the patients are very well aware of any allergies they might have or any conditions they might have that would need the compound to be changed. So the patient will report to us. I typically give them a call when they're a brand new patient. I do kind of a patient interview with them at first, get all this information down. If something comes up after the fact and it's a allergy that the patient was not aware of, that's easy fix to come back, report it to the physician, and then all current compounds will be adjusted from then on.
Mm-hmm. And have any of your patients reported to you any negative side effects? I know you mentioned the sleep there, but has there been anything else other than that?
So far, there hasn't been any other reports besides the very typical vivid dreams and the sleep disturbances. We've had a lot of patients even say that they haven't that they've kind of slept better since they got in it. The vivid dreams are a little bit of more of a welcome than just the sleepless nights that they had. But other than that, no major side effects have been reported back to us.
Mm-hmm. And what conditions mainly are the patients taking LDN for?
Currently, we do have a wide variety of conditions. We focus on everything from autoimmune diseases to a couple of genetic disorders that we have that some physicians have looked at. But at the current time, we basically just leave it up to the physician and to kind of adjust for whatever the condition that they have or whatever they feel is necessary or LDN would be beneficial for. So we do have just a wide variety, more than I could probably list at the time.
Mm-hmm. Okay. And what would you say the age range of the patients are at the moment? Have you got any children on it?
We do not have any children currently. Most are between the ages of 20 to, I would say, about 30 to 40. We do have some older patients as well, up in the 50s and 60s, but we have a extremely wide range at this time, just nothing usually younger than 20.
Okay. And what about older patients where maybe they might be using it for Parkinson's or something like that? Would you know that?
Off the top of my head, I wouldn't. It's definitely a good question that we would love to look into further, but we just haven't had any direct experience with that at the time.
Mm-hmm. I had a doctor who's looking into LDN for Parkinson's and Alzheimer's, so I find that really interesting. I did send an email out to ask all the patients, do you take LDN for Parkinson's or Alzheimer's? Unfortunately, nobody got back to me who were taking it for Alzheimer's, but for Parkinson's I did. And I've interviewed some of them, and it would seem, I think I've only interviewed 4, but 3 of them, LDN didn't really help improve much, but they stabilised. I think one gentleman was still deteriorating, but very, very slowly. So he was really, really pleased. And I interviewed another gentleman who he just says most of his symptoms went and he became back to being the person he was, which was like, wow, absolutely amazing. I mean, when you've got a progressive disease, halting it is fantastic, and getting symptom relief or even, as he said, reversing it is something else, isn't it? It really is amazing.
Definitely.
So, yeah. And we were talking about using the LDN app and things, so we're looking forward to discussing that with you further. I'll have to send you an email. If we can get more pharmacists like yourself, and I'm sure having a research background as you have probably makes you rather inquisitive, which has to be good. And
certainly.
To get younger, inquisitive people on board, because a lot of these doctors who have been prescribing LDN, or the pharmacists, are aging just because it started, in the late 80s when a lot of them started. So, getting new blood, taking up the baton, if you like, is fantastic. And we would really like to work with you and with this education program that you've got going, because, as I said to you before we started, that is something we're working with pharmacists to do, to try and roll out a program to educate doctors. And we feel that the way to educate doctors is through the pharmacies, because the pharmacists have more time and they can spend longer with patients, but they can put a package together for a doctor where the doctor then feels confident to prescribe LDN. So I think what you're doing is absolutely wonderful.
We appreciate that. And we definitely think that the number one step right now that we can make is just educating and outreach to not only for us personally, the community of Columbus, but for the state of Ohio in general, just to educate both the patient and the physician as a whole.
Mm-hmm. So how big an area do you cover? Can you dispense for the whole of Ohio, or is it more localized?
We are currently, our pharmacy is in northern Columbus, Ohio. We do ship and work with everyone in Ohio. We have a wide range of outreach in general with the population, but we are focused at first just on central Ohio, but our overall reach definitely spans to the Ohio as a whole.
Mm-hmm. So anybody out there who's listening to this who thinks they would like to talk to you and get some expert advice on LDN and whatever condition they may have, you would be happy to talk to them, would you?
Of course.
So how would they get hold of you? What is the best number to get you on?
So the best number to reach myself or the pharmacy in general is going to be 614-847-0109. And I am typically in the offices on Tuesdays and Thursdays until about 1 o'clock, but I can be reached at any time at my email, and that can be found at ctaylor@cocprx.com. And I can get back to you, a phone call, I can get back to you as soon as I get back into the office and get caught up, and then as an email, I can get back to you right away.
Mm-hmm. And what is the website address if people want to go and find out more about you?
You can either go ahead and Google search Central Ohio Compounding Pharmacy, or you can go to www.cocprx.com.
Mm-hmm. And what would you say to patients that are listening who haven't actually started LDN? They're still doing their own research to find out if LDN is something they want to try. What's your advice on LDN to somebody who's not yet taking it?
I always say my number one advice for brand new patients to LDN or ones who are even looking is definitely do your own research. Definitely see if it's something that you'd be willing to try, and then reach out to either your personal local physician or contact a pharmacy like ourselves that is able to put you in touch with a doctor who is experienced with LDN. Those who have written LDN before are a great resource to go to and actually work with to see if LDN would be proper treatment for you.
Mm-hmm. And the doctors that you work with, are they all in your area, or do you have others in Ohio?
Yes, we have some. Most are localized in Columbus, but there are several that we work with from northern Ohio and southern Ohio.
Mm-hmm. Wow, that's really interesting. And do you ever recommend patients take anything else alongside of LDN?
That's something that we really leave up to the doctor, and after we work with the physician, they'll give us a call, let us know if they think LDN is proper, and then we'll kind of work with the doctor together to decide what current treatments might be beneficial for them, what additional treatments might be beneficial, but it's definitely kind of a dual decision between the physician and ourselves.
Mm-hmm. And what do you recommend about diet and supplements?
That is typically something that we have a few other pharmacists that actually work on different programs in our pharmacy, and that's kind of their focus at this time. Since I just kind of focus with LDN, I leave that up to them, but it's certainly something you can give us a call, and we have some advice for patients on that as well.
Oh, that's wonderful. Well, I just can't believe everything you're doing. Absolutely amazing. And, well, long may you
we appreciate it.
Educate these doctors. And, well, LDN, we have to, the caveat we have as a charity is that LDN isn't a miracle drug or a cure and that it doesn't work for everyone. But it's certainly something you can try. It's not going to do you any harm. And the success rate that I have seen in the last 14 years has been amazing. You know, there are some really extraordinary stories out there of patients who are using LDN.
Mm-hmm. It's quite amazing being able to work with you guys and seeing the stories that you guys talk about on the station, and just hearing actual reports from the patients themselves is quite astonishing.
Well, thank you very much for having joined us today.
Thank you for having us.
This show is sponsored by Dixon's Chemist, who are the experts in LDN and associated treatments in the UK. Dixon's Chemist are the most cost-effective for LDN in all forms within the UK and Europe, maintaining safety standards far in excess of what is required. Why would you choose to get your LDN from anywhere else? Call 0141 404 6545 today to speak to their LDN experts. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.